Welcome to Communitie 1490 AM ABC News Radio and the Southern California Business Report with Yvette Walker, a show dedicated to highlighting successful Southern California businesses and the people behind them.
Welcome and thank you for joining Southern California Business Report on ABC News and Talks, KMET 1490 AM, 98.1 FM, and KMET TV. I'm Yvette Walker, live, blasting our signal from the center of Southern California, serving a population of over 25 million. Get us crystal clear and on demand by downloading the free live streaming app on Google Play and the Apple App Store. As always, a huge shout out to the team, Mitch, Bill, and Sean. I love you guys. And to our special advisory committee that can be found at www.scbrtalk.com/advisory committee. Click on the link and learn about the remarkable leaders doing the work. All right, everybody, speaking of leaders, I am so thrilled to introduce Susan Harrington. She is the president of Communities Lifting Communities. Susan joined the Hospital Association of Southern California, known as HASC, as the executive director for Communities Lifting Communities in July of 2018, and since February of 2021 serves as president of Community Lifting Communities, an affiliate nonprofit organization of Hospital Association of Southern California. Susan leads the development of strategic initiatives and projects to advance community health and reduce health inequities across Southern California. Susan develops and manages the CLC organization, staff, and strategic partnerships. Susan earned the Diversity First Certified Diversity Executive designation in June of 2022. Susan is a registered dietitian, nutritionist, and has worked in public health for over 36 years. Prior to joining CLC, Susan was a former director of the Riverside County Department of Public Health. Susan holds a master's degree in nutrition from the University of Nebraska, Lincoln, and a bachelor's degree in dietetics from the University of California, Davis. Susan's interests include astronomy and astrophotography, and she is a member of the Riverside Astronomical Society. Susan enjoys RVing, boating, sewing, and spending time with her husband, children, and 5 grandchildren. You have a full plate, Susan. Thank you so much for being with us today.
Thank you, Yvette. It's a pleasure.
Wonderful. That astrophotography, I want to learn more about that after the show. But as you know, my first question to every one of my guests is to please give us, a brief history and time in your journey to becoming now the president of Community Lifting Communities along HASC.
Thank you, Yvette. And as you described in my bio, I started my career in public health with Riverside County as a nutritionist, and I worked with the nutrition programs and the WIC nutrition program. And not too long after that, I started promoting to higher levels of responsibility, served as a deputy director, and also worked with health education and maternal and child health programs, and then served for 12 years as the director of the whole department, where I then needed to learn about disease control, emergency preparedness and response, and also managing 10 community health centers and working closely with the county hospital. I retired, as you said, in 2016, traveled a bit, consulted with another health department, and also served as an adjunct professor. And when the position opened in 2018 with HASC, it was I just couldn't pass it up. I wanted to work with them to stand up this new initiative, Communities Lifting Communities.
I love that. So please talk a little bit about how Communities Lifting Communities came alongside HASC, or Hospital Association of Southern California, how that idea was formed and how those two organizations now run parallel.
So HASC was founded in 1923. They just celebrated their 100th anniversary, and they're a nonprofit trade association working with hospitals in 6 counties across Southern California. So CLC has the same region as the Hospital Association of Southern California, or HASC, including LA, Orange, Riverside, San Bernardino, Santa Barbara, and Ventura counties. The common goal of HASC is to improve the operating environment for hospitals and the health status of the communities they serve. And we work closely with the California Hospital Association on policy and advocacy issues impacting hospitals and health systems. In 2017, the board of the Hospital Association came together to say, we want to bring on a new initiative, Communities Lifting Communities, that will help bring together not just hospitals in their service area or a health system in their service area with multiple locations, but along with other sectors, public health and behavioral health agencies, community clinics, Medi-Cal managed care plans, and other stakeholders, because they believe that collectively we could do more to improve health outcomes than individually. So we are designed to bring those collaborative members together and work on systems change. Also, as you mentioned, after being an initiative for a few years, we achieved our federal nonprofit 501c3 status.
Very nice. So talk about how CLC and HASC work together in terms of addressing the prevalent needs within the communities from a health aspect, right? Is it the community health needs assessment? Please talk about where you gather that data, how you prioritize that along HASC, and, what is the game plan from there?
So community health needs assessments are requirements for a number of different types of organizations. Our nonprofit hospitals, our public health departments, community clinics, and now behavioral health departments, and our managed care plans all have a requirement to assess the needs of the community. And then once they prioritize those needs, they are able to identify what kinds of strategies to improve health and have better outcomes. So a typical needs assessment process includes looking at primary data. That will be data that you get from your interviews, listening sessions, and focus groups from the community members who are saying, I think this is a real health need. And then we look at secondary data, and that data a lot comes from our hospitals, looking at inpatient and emergency department utilization, looking at health conditions like diabetes or heart disease, leading causes of death. And then recently, we're looking at social determinants of a person's health. How does their housing situation or their job situation, transportation, healthy food, how does that impact their health? And then the community health assessment helps the organization, whether it be an organization or in the case of some examples in Ventura County and the Inland Empire with Riverside and San Bernardino counties, we can look at the current health status, the ideas and needs, and then this information helps us develop and then justify strategies with the community's input that can really make a change in a person's health.
Absolutely. So based on that data gathering and the health needs assessments, what are those prioritized health needs that are just prevalent in the community today?
So when I joined HASC and the executive director of Communities Lifting Communities in 2018, those recent needs assessments showcased that in LA County, we needed to address the birth outcomes for Black moms and babies. Black moms were having an incidence of greater than white moms with preterm births and hypertension. So how could we work together with the public health department in Los Angeles, the hospitals, and other community partners to improve birth outcomes? And that resulted in an initiative that we just concluded, Cherished Futures for Black Moms and Babies. And we did see improvements in outcomes and moms' care with hypertension, with doula services, and improving the patient experiences. We also worked in Ventura County early on on a diabetes prevention program. And what they determined is for every patient that was newly diagnosed with diabetes, they wanted to assess their access to healthy foods. And so we worked on what would those questions be that you're going to ask the patient to say, how do we know that you have access to healthy foods, that you have food in the cupboard, and then are those foods that are helping you with your nutrition and lifestyle? More recently, in the 2022 cycle of many needs assessments, we're addressing homelessness in Los Angeles County. We're looking at advancing community health and improving access to care in Ventura County. And then, most recently, in the Inland Empire, we've launched a behavioral health collaborative. And with the Behavioral Health Collaborative, when that needs assessment was published in 2022, we saw that behavioral health, mental health, both looking at depression as well as substance use disorders were a great need, both with finding access to care as well as moving upstream to prevent those types of needs and services that might be realized in the emergency department.
So, given all of those new data, right, evolving from Black mothers suffering from early births due to hypertension, and then evolving now to Behavioral Health Collaborative, please talk about how you're able to bring these stakeholders together, create a plan, and activate it. What process are you in today?
So, Yvette, we're working with what we're calling multi-sector collaboratives that bring together the hospitals and health systems in a region or a county, the public health and behavioral health departments, the managed care plans, the community-based organizations and clinics, as I said, to look at the needs. And then what might the strategies be? Well, you can't just have a report that looks at, here's the need, for example, behavioral health. You need to activate and organize those stakeholders. So the process is to gain commitment and interest. And many times we'll meet with our hospital CEOs and say, here's this need. Will you join us in that work? Then we develop a charter that talks about the purpose of the group. It talks about having a steering committee for decision making, and then a set of meetings or work groups that you could then look at strategies, look at the data to really see how you can make an impact. And then we develop that action plan. And it usually takes 6 months to a year to really gain momentum and look at what those strategies might be, identifying the gaps in services and the needs, and then align maybe some strategies for co-investment, and then developing that action plan, and then moving to implementation, where we'll look at what are those outcome metrics and measurements. Are we looking at reducing, for example, emergency department visits for someone who has a behavioral health need because they're now getting their care in an outpatient setting? Or looking at reducing utilization of the hospitals for unhoused patients because now they have housing and a connection to a provider or clinic services and that type of thing.
Right. And so behavioral health is such a broad term, Susan. Can you kind of break it down and give us, a little more guidelines as to what falls under behavioral health and the real impact that behavioral health is having on hospitals today?
So behavioral health, you're right, is a broad category of diagnoses. So it would include depression, it would include schizophrenia. It's also different than substance use disorders that might be caused by drugs or alcohol. So behavioral health is kind of a catch-all category, I would say. But when you look at our hospitals where they have patients coming in with these diagnoses, that then they code all those specific diagnoses. And then we can look at that data to see where are the gaps in service and how can we better serve their needs. So in the Inland Empire, with our focus on behavioral health, we're focusing on 3 different areas. We're looking at prevention. So our community health leaders are saying at the hospitals, they're saying we want to work with schools and school-age children to make sure that they have access to counseling and education about the prevention of behavioral health and certainly reducing incidence of substance use. We're also looking at the types of patients that are coming to the emergency department who are in crisis. Sometimes they'll come to us because they come on the ambulance or maybe a police officer will bring them to the emergency department, and they need to be assessed to see what is their health need, what is their condition, and then where can we make sure they get the best care possible. And what we're finding is that the number of services in an outpatient setting in the Inland Empire, as well as the number of beds that a person might need to get that treatment and care, are not meeting the needs of our population. And so the third group is looking at that system of care. How can we identify gaps in services, both prevention as well as treatment, and then what's needed, and can we come together as a community, working with the county, working with hospitals and health systems, our health plans, the community members, to determine, again, where can we go, what do we need?
Please talk about the response that you're getting from schools, right? Because sometimes going to a counselor is not such a popular thing. Kids have certain, internal questions about being a part of that or being perceived as a student that needs those type of resources. What are you finding in terms of the reception and use of those services and offerings and programs in the school systems?
So many schools have adopted a program called Mental Health First Aid. And this does provide education to students. Many times there will be peers there who have training and who can help them reduce that stigma. And then having those counseling services available to those students as well as the families.
And what do those numbers show? Is there showing an increase in use of those services and programs, hopefully?
We are seeing an increase. And, after COVID, having our students home, doing education online for a long period of time, there are some adjustments happening. And so they are utilizing those services. And one of our partners is a superintendent of county schools who is working with this collaborative so that we can really identify what are those best programs, and then how can we work together and collaborate with the healthcare system as well.
Absolutely. So I was also been privileged to be a part of San Bernardino County Superintendent of Schools during the panel where they have the students come out and identify challenges within their own schools, and the mental health programs came up and how to eliminate the stigma. One of the most brilliant recommendations I heard come from the students suggested that they should have an app that is anonymous, and you can, chat with the counselor or make a very private appointment with them so that they're not announced in the classroom and say, hey, Johnny, or hello, it's time for you to go see your counselor, make it a little bit more private. Are there specific programs or efforts that you're finding are more popular or have a more positive response by the students?
I'm not really that versed in specific programs, but the point you're making, where students are coming up with great solutions, is really important. They have this lived experience. They're having some challenges. They have peer pressure. So to listen to them and then say, what can we do? Can we be innovative and develop an app, for example, so it's more anonymous? Or can we provide a certain service in a neighborhood? Or that type of thing is really what we're trying to do too, as well, is listen to those folks with lived experience, whether they might be unhoused or homeless, or have diabetes, have other types of health needs, and see what they come up with as strategies.
I absolutely love it. I love that you incorporate all of the voices, all of the necessary stakeholders into the conversation to come up with the best solution. Susan, please talk about your leadership programming and the categories of healthcare you're working on today.
So we at the Communities Lifting Communities have the real benefit and opportunity of working very closely with the hospital CEOs, over 173 hospitals and 31 health systems in the 6 counties that I described. And working with that level of professional, the leadership, the decision maker in the hospital is really a great way where we can identify those needs and test out, here's some ideas that we would like to do. How can we serve you? How can we help you meet your needs in improving outcomes at your hospital and in the communities you serve? We're also working closely with other levels of hospital leadership. We're working with chief nursing officers, chief medical officers, the community health folks. We're also working with the supply chain managers now, looking at how we can bring in more diverse small businesses to have contracts with hospitals and improve the economic opportunities and conditions in the communities nearby.
That is absolutely brilliant. Please talk about the current collaborative efforts you're working alongside with these 170 CEOs. It sounds to me like that's a big undertaking to, take all of that information and all of those needs and all of those perspectives and funnel it into, a broader, very, useful plan of action for addressing these challenges.
So I can talk a little bit about our work in Los Angeles County with the Los Angeles Assessment and Action Partnership, known as the LA Partnership. This is a collaborative of about 30 nonprofit hospitals in Los Angeles, the 3 health departments. So we have the county health department. We also have health departments in the city of Pasadena and the city of Long Beach. We're working with our managed care plans there as well as community partners. And in 2021, so coming, in the middle of the pandemic, they decided that there was really an aligned need to address patients who are unhoused or experiencing homelessness. And CLC led research working with some consultants with the Public Health Institute to interview the hospitals and say, what services are you currently doing for people who are unhoused? What are your plans and what communities are you working in? And our research showed that hospitals individually or in alignment with other hospitals or organizations are working in 3 areas. They're working with street medicine programs. They're working with recuperative care or respite care, where a patient is unhoused and they're discharged from the hospital to a safe place so they can heal. And then also looking at community health navigators. These are community health workers who are working closely with the social workers and discharge planners in the emergency departments, making those connections to housing and social services and food and other needs that they have. So in May, Communities Lifting Communities released our report and recommendations for aligning hospitals and health systems, and we selected some best practices and scalable solutions in those areas. As I mentioned, street medicine, recuperative care, and community health navigation. So now what we're doing is establishing some work groups where we're bringing in not only the hospitals that have those model practices that we want to share, we're now looking at how can we be reimbursed for this? Because our health plans now have benefits for unhoused patients that help them to get to the housing and services that they need. They're also paying for street medicine programs, for example. So how, if a hospital wants to be engaged in that, how might they go about that? So we're doing some training there. And hospitals, as I said, sometimes they're standing up their own team or a service. Other times, especially the nonprofit hospitals, might be providing grants to community-based organizations who already have that network set up in the communities of need and helping fund that service.
Please expand a little bit on the street hospital services, just briefly.
So street medicine services are led by a number of hospitals across the state, but in LA County, we're working closely with USC Street Medicine Program and UCLA's Homeless Collaborative. MLK Community Healthcare also has a street medicine department. And what this is a service where a team of doctors, nurses go out either with backpacks on or in a van to where homeless patients are. And they will work to identify services that they might need. They'll follow up on what a discharge instruction might be. Sometimes they'll provide wound care. But we're having some challenges now with the recent sweeps of encampments to find these patients. And it's not just providing the care they need after discharge where they are on the street in an encampment, but it's also connecting them to housing and measuring how many patients were we able to do and connect.
Perfect. I love it, Susan. We are on a break right now. We'll touch base and follow up on that in a moment. Yvette Walker with ABC News with Southern California Business Report here today with Susan Harrington, a visionary leader and advocate for community health empowerment, is the esteemed president of Community Lifting Communities. With the remarkable track record of fostering positive change, Harrington has been instrumental in spearheading initiatives that uplift underprivileged neighborhoods and bridge societal gaps. When we return.
Cal State San Bernardino is home to the only school of entrepreneurship in California. With globally ranked degree programs, you can start your journey today to become a successful entrepreneur. Learn more and connect at entre.csusb.edu.
Hi, I'm Dana Rademacher with MGR Property Management.
A lot of people wonder about the value that property management has for their property. Property management can include all property types, including residential, commercial, and HOA. It is valuable because property managers are experienced in what can happen at your property. We're aware of liabilities. We're able to do predictive and preventative maintenance. We know what is coming up with the changes in the weather, the seasons, how old certain aspects or different capital projects at your property are. We're able to best negotiate contract pricing, legalities with your tenants, and anything else that you may need to ensure that you're getting the full value of the property.
If you're interested in speaking with the representative at MGR Property Management regarding your property management needs, you can visit our website at mgrrealestate.com, or you can call our number at area code 909-581-6600 to be connected with a representative.
Ontario International Airport is onto a better way to fly with over 65 daily nonstop flights to more than 20 major destinations and the easiest airport experience in Southern California. Visit flyonto.com/Ontario to learn more about Ontario International Airport today.
Hi, I'm San Bernardino County Sheriff Shannon Dykes. If you're looking to start an exciting career in law enforcement and make a difference in your community, we are hiring dispatchers, nurses, deputies, laterals, and many more. For a complete list of our jobs and more information, visit sheriffsjobs.com.
The University of La Verne is rated first in California for alumni satisfaction. Learn more about accelerated programs offered online and on campus in La Verne, Irvine, Ontario, Burbank, or College of the Canyons. Visit go.laverne.edu. The University of La Verne. go.laverne.edu.
We are the Empire Strikers, the professional sports team of the Inland Empire. We are a fast-actioned and community-inspired pro indoor soccer team. Our mission is to inspire the Empire. Home games, community events, watch parties, and youth camps are all back. Professional indoor soccer is back. Join us and come watch the greatest show on turf at Toyota Arena or on Twitch. Visit www.theempirestrikers.com for more and any information.
Welcome back, everyone. Yvette Walker with ABC News and Talk, Southern California Business Report, here today with Susan Harrington, a visionary leader and advocate for community health, empowerment, and the esteemed president of Community Lifting Communities. With a remarkable track record of fostering positive change, Harrington has been instrumental in spearheading initiatives that uplift underprivileged neighborhoods and bridge societal gaps. Thank you so much for being with us today, Susan.
Thank you, Yvette. It's my pleasure.
Beautiful. So prior to the break, we were touching on street medicine and how healthcare providers go out on the street to deliver some of these critical healthcare needs. I know you mentioned that as of late, it's been a little bit challenging to interface with unhoused people. Please talk about why that is, what changes have occurred, and how you are overcoming that, how street medicine can overcome that.
So there are recent sweeps in some of the encampments throughout Southern California. And what we've heard from our street medicine teams is that they're having some challenges identifying where their patients are. But many of them have a network. And as they are working at shelters, working in other areas, they're connected to say, I have this patient, I found him or her, and here is where they are now and where their need is. So there's quite a collaborative within Southern California, and the Community Clinic Association of LA County is actually coordinating a street medicine collaborative where the providers and clinics are connecting and are working on piloting kind of an app of sorts, as well as a database, so that they can have documented there what needs these patients have, their treatment protocols, and that type of thing. So they're working through this, a lot of communication and happening. And then if there is a critical need, the unhoused patients will come to the emergency departments for help, and then that's another way to connect back with their providers in the community.
Now, is that the role of the healthcare navigators to kind of coordinate these different elements and groups on the street? How does that work? Please talk about the healthcare navigators in this scenario.
So the community health navigators are community health workers or other team members that a hospital will have in the emergency department, and they work very closely with the discharge planners and the social workers, particularly for unhoused patients, but other patients who might need services and supports. But for the unhoused patients, they do work to connect them to shelters, to housing resources as they can, as well as providing clothing and food and transportation. And many times they'll also work to try to identify where they could go. Some patients who are discharged will go to a recuperative care site. And another nonprofit affiliate of the Hospital Association of Southern California is the National Health Foundation. And they have a number of recuperative care sites where those unhoused patients can go and get medical care and food and, again, navigation to housing and other services that they might need.
Wow, I love it. It sounds like a very concierge service and a dedicated person with the correct resource for the specific dynamic.
And, you know, each county has a different homeless continuum of care with those resources for shelters and housing, a number of organizations and nonprofits working together. So they are working at a level also to address the needs for housing and connections to recuperative care. So a lot of coordination happening, a lot of needs though. And I don't think there's enough staff to take care of everyone. But again, a lot of people are working hand in hand to see what's the best system of care and how can we utilize our resources effectively.
Right. So it sounds to me like there is a future for healthcare workers and health navigators. There is a need for workforce development on those fronts. Can you speak a little bit to that?
Yes, so there's a lot of movement now to train folks to become community health workers. There's programs throughout Southern California. And I think what's helpful now is our Medi-Cal managed care plans, Inland Empire Health Plan in the IE, LA Care Health Plan in Los Angeles, just to name two, now have a community health worker benefit where they can be reimbursed as part of a healthcare team, or a community-based organization providing those services can be reimbursed for members who are Medi-Cal eligible for those services. So having training programs, opportunities to become certified is something that is an important aspect of our workforce development work at HASC, working with colleges and local programs who are training community health workers. They're also doing workforce development with nursing and mental health professionals, and it goes on and on. But a lot of collaboration going on there too as well.
Now, I'm guessing that's probably something you go into the schools as well too, right? To start guiding the young students into that workforce mindset. Exactly.
That is talking about those health careers early on in elementary school, middle school, and of course, high school.
That is so exciting and absolutely brilliant. And, honestly, talk about work, job security, right? And in today's environment and the local economy, there's always going to be a need for healthcare, for serving others and taking care of others. And unfortunately, the need is growing. It's not shrinking. So hopefully we can create a robust pipeline for that workforce development and, get everybody taken care of. Susan, please talk about your recent work in the Inland Empire and the partnerships you've established to identify, the pressing healthcare data specific to our region.
So I mentioned a little bit about needs assessments early on, and in September of 2022, the Inland Empire Community Health Needs Assessment was published, and this effort was led by Inland Empire Health Plan. We have 5 nonprofit hospitals who participated, as well as coordination with our Riverside and San Bernardino County Departments of Public Health. And the needs assessment did show that mental and behavioral health as a top need. We mentioned a little bit of data looking at hospital discharges for people who have behavioral health or substance use disorders. And so in October of 2023, one of our hospital CEOs, John Chapman at San Antonio Regional Hospital, spoke to the Riverside and San Bernardino County hospitals to say, here's the need. Join me on a collective behavioral health effort. And at that time, we didn't know what it would look like. So Communities Lifting Communities worked with HASC to survey the hospitals on what services are they providing right now for behavioral health and substance use disorders. How many beds are available? What programs are you working with? What are your challenges? And then where are those opportunities to collaborate and work together? We presented information back on kind of what's needed, what's existing. We're still doing that asset map to find out really what is the need and where are the gaps. And then in January of this year, we launched the collaborative. And we have 28 of 41 hospitals in the Inland Empire, so almost 70% of our hospitals have signed on to participate in the collaborative. We have both health plans, Inland Empire Health Plan and Molina Healthcare, and the San Bernardino County Superintendent of Schools, who have signed the charter, which says, our aim is to look at the behavioral health needs in Riverside and San Bernardino County, look at how we can collaborate, and hopefully meet then with local elected officials at the county and the city level, work with the behavioral health departments in both counties, and look at ways to once we identify the gaps, how can we improve that system of care? So we have our community health leaders who are focusing on young people and prevention. We're looking at the system of care and also improving the experience and reducing the time in an emergency department that someone with a behavioral health need is spending. And where can we find those short-term solutions, investments, but also looking at the system of care, and do we need additional facilities? Where should they be located? And how can we work collaboratively with those community-based organizations and providers already to build their capacity?
I absolutely love it. And so of the 41 hospitals in San Bernardino and Riverside counties, it sounds like you have 28 on board. When are the rest going to come on board? And again, right, we're going to put them on blast right now. They need to come on board. And what happens when they do? When you have all 41 hospitals and you're creating that that key programming, those key efforts, how do you even begin to get everybody on the same page to initiate the same standard of care or protocols?
Well, I think the protocols and standards of care might be a little bit different depending on where you're located, what resources are available. I think really having the leadership and other hospital CEOs meeting with our county leaders in behavioral health and public health and the supervisors. We work really closely with our regional vice presidents at HASC. And their role is really the policy and advocacy and promoting the needs, educating where there might be opportunities for recommendations, and that's kind of where CLC comes in. But they're the ones who have those relationships with our local elected officials. And we're working closely with them because we really believe, yes, we want 41 hospitals participating at all levels within the organization, not just the CEO, but the emergency department directors, the chief nursing officers, the case managers, and discharge planners. So we're working at different levels of staff in the hospital, and we want them to share and showcase their model practices and protocols. So we believe it's going to take a village and a lot of will, both at the care delivery side, but also having those community inputs and members talking to us about the strategies, working in partnership to not duplicate the efforts, but really identify what's needed. Where are those resources now? Where are those services? And then where can we find in communities of greater need that place that will help with that connection to a crisis center, perhaps, or a behavioral health team that goes out into the community to help. And so it's really this big collaboration. And I think this is the first time focused on behavioral health that we're seeing all of these leaders come together and really willing to talk about the possibilities. So we convene, we help facilitate, we help identify the needs and where some strategies might be that we can align, that we could scale and spread best practices. But then we need to hand that to our other leadership and have them take that baton and work together at those different levels.
I absolutely love that. Getting everybody on board, streamlining the process, eliminating redundant efforts or efforts that don't work, cutting spending, obviously, to be most effective. But Susan, tell us about the current behavioral health program collaborative. Is there a framework for it currently? What does that look like?
So we, right now, we have, as I said, 28 hospitals who have signed on to the charter. So we have their leadership and their teams attending work groups. We're developing those plans of action. Now, we're also meeting with the departments of behavioral health from Riverside and San Bernardino County and have them share with us what are the services that they're providing. What are they working on to help the needs of their growing populations? And then where can we align and focus those efforts at the policy and advocacy level and hand that to our HASC team to talk about the local electeds. So we have a quarterly collaborative meeting where we're coming together either virtually or in person, where we're sharing best practices or resources that are of interest. And then our work groups are meeting monthly to develop those action plans and look at what needs there might be. And then the other thing that Communities Lifting Communities is doing is we're leading the effort for with our philanthropic foundations, with our hospital leaders to say, what kinds of funding is available? You know, the funding to support Communities Lifting Communities as the facilitator, the integrator, you know, standing up these work groups and developing the plans. But then once we identify those strategies that we want to implement, what funding is available for that? Is there reimbursement through a healthcare plan? Is there interest from a foundation or another organization that might want to sponsor this change? Can we do a pilot program and talk about and share those practices that maybe one or two hospitals are testing out to see if it really works? We also have a steering committee. And one of the things Communities Lifting Communities is really working on this year is in addition, so not only, but in addition to having leadership from our different organizations, community healthcare, health plan, we want to engage our community members to center their voices. So we're working with community organizations to help identify community residents who would like to participate in this decision-making process. And then what makes that engagement by a community member who has lived experience, maybe homeless or have a behavioral health diagnosis, how can we make it meaningful to have them come and join us with this planning and then test those interventions? So we're working to set that process up as well. And a lot of our hospitals have advisory groups who are patients who will advise a hospital. We have collaborations with health departments who might be working with different populations. So again, if we could not duplicate, but find a place where community members are engaged, have that be meaningful, and then have several of them join us in this decision-making process so that we're informed by those folks who are actually receiving the services, and not just, picking a best practice and say we'd like to do it here, but really engaging the community. And that's an area of our focus this year across our initiatives at Communities Lifting Communities.
Wonderful, Susan. We're heading up towards the end of the hour here, but quickly, please share how it is the community can support your efforts and what is the best way to communicate with you.
So reach out to us on our website, communities.hasc.org. It'd be great as community health assessments are occurring. There'll be publications, announcements, radio, and in other groups. Participate because we want to hear from you, the residents. Also, let us know if you're interested in joining our collaboration, whether you're working in a healthcare area or community-based organization. We'd love to talk with you. And then as local hospitals and health departments and our health plans have advisory groups, participate in that way as well.
That is absolutely brilliant. Thank you so much for your dedication, your ability to wrangle all these groups together and take on such heavy needs in our community. I know it's overwhelming to think about all the needs that exist and all the pieces that have to come together. But as the pieces come together and the direction is set and everyone starts kind of moving in the same direction, I'm very excited to see what the final positive impact is going to make on our communities, make them healthier, establish and prioritize that continuum of care, and just create healthier communities. And thank you so much for your work at Communities Lifting Communities.
Thank you.
All right, for everybody listening, don't forget to find us on Facebook, YouTube, LinkedIn, and Instagram. Check us out on scbrtalk.com. And don't miss my interview with Jared McDaughton. He is the Chief Executive Officer of the Inland Empire Health Plan, also known as IEHP. In this role, he works collaboratively with the IEHP Governing Board to set the strategic vision and provide executive leadership for one of the 10 largest Medicaid health plans and the largest not-for-profit Medicare/Medicaid public plans in the U.S. He cultivates IEHP's strong partnership with providers, hospitals, and hundreds of community partners to deliver quality whole person care to more than 1.5 million members. Next week, we will have Lupe Valdez, Director of Public Affairs at Union Pacific Railroad, who joined the Union Pacific Railroad as the Director of Public Affairs in July of 2005. She serves the Los Angeles basin, including Los Angeles, San Bernardino, Riverside, Ventura, Santa Barbara, and Imperial counties. Her responsibilities include working with local elected officials and community groups in Southern California. Lupe attended the University of Southern California, where she earned both a bachelor's and a master's degree in public administration. Lupe actively participates as a valued member of the San Gabriel Valley Economic Partnership, is now the Senior Director of Public Affairs for the Union Pacific Railroad, and currently holds the title of Chairwoman for the Inland Empire Economic Partnership. You do not want to miss it. We will see you all next week.